Hello, guys. Welcome to another episode of Emilokon. It's been a long time. This is the first time that I'm officially appearing on camera. I'll see how it goes. Maybe I'll edit this out. I don't know if I'll just leave the guest video in the thing. Um, yeah, we've got a special guest today. Um, I don't know. I think I couldn't do an introduction justice, but I guess one has to, yeah, just continue. But without further ado, could you please introduce yourself, Mr. Suleiman?
Yeah, I'm Dr. Suleiman, Dr. Olayinka Suleiman. I'm an ENT surgeon from Nigeria um, with subspecialty in hair and hearing care otology. And I'm presently based in the United States doing my graduate studies in public health at Emory University. I'm a researcher, humanitarian, and also a mentor to younger ENT surgeons in Nigeria. And I'm also the director of Hearing Mission of Suleiman Hearing Educational Foundation. I've worked in Nigerian hospital in the Federal Teaching Hospital Katsina for about 16 years, and I've visited a number of hospital centers in northwest Nigeria, developing hearing care program, including the National Ear Care Center, Kaduna. That's one of my. I'm a dad to three lovely kids, and that is me. In short.
Yeah. So this one is very special because Mr. Suleiman, this is my maternal uncle, my one of my mom's younger brothers. My yeah, my mom's younger brothers. And yeah, like you said, been a mentor to me. Like exhorted me a lot. Like given a lot of wise counsel and kind of been an example. Um, but to just segue, could you explain what an ENT is, if you don't mind me asking?
Yeah, explain what?
What an ENT is for the viewers that may not know what an
Okay,
ENT is.
ENT is also the other name is otorhinolaryngology, ear, nose, and throat. That's what it stands for. It's a subspecialty of surgery and for treatments and prevention of ear disease, nose and throat disease, and head and neck cancers. So it's the specialty is take care of ENT head and neck, and it's also work on treatments of the disease in that area and also in prevention of the disease also in that area.
Okay. So what would that entail? Like working with hearing aids? Would that entail? I forgot what the thing is. Like hypothyroidism. Would you work with things like hypothyroidism and stuff like that? What is that kind of?
No, what happened is that if you look at the ENT generally, when you say ear is like we call it it's also so specialized in terms of ENT. Some people go into ear just treating ear disease and prevention of deafness on its own. That's otology. That's the area that I also specialize myself in. There's also some people that goes into the nose, disease of the nose, like breathing issue. Some has a blockage of the nose, which will come from discharge or growth in the nose, or blockage from the nature their nose was built naturally. And some people specialize in that in order to treat the disease of the nose, and others are throat issues. Throat issues, that's the way we swallow up to the level of the esophagus for us to feed. The ENT is also that specialize in that. Some people also go into those area. But you are talking of the thyroid. Thyroid, if you look at the neck, the thyroid is located at the anterior part of the neck. and inside the anterior part it could be like an enlarged thyroid, that the one they call goiter. The
Okay.
hyperthyroidism you are talking of the other function of the thyroid that produces hormone for other aspects of life. So that one is not related to the size of the goiter, but is related to the internal factor like the hormonal generation. So those are different parts of. So the ENT also take care of when the thyroid become enlarged and is causing problems, either causing excessive hormonal secretion that is now causing disease, or is causing compression of the neck and making somebody difficult to breathe or difficult to eat. Then the ENT also remove that thyroid and reduce the size. So some people work in that area. That's what they want to call it neck surgeries. The neck
Okay.
surgery is also part of ENT. But for me, I'm more into ear and hearing care. So your question should be related to more of ear and hearing care. That's the area I specialize in ENT. Thank
Okay.
you.
Cool. So could you take us back to the beginning? Where did you grow up, and what was the environment like that
Yeah,
produced
my
you?
background is mixed. I was born in northern part of Nigeria. I was born in Kano. That was in northwest Nigeria where I grew up. So as a teenage, as a toddler. Then that time my dad was working in the northern parts, in the northern province. He worked in different part of the north, the Bauchi. I know he worked in Kano State. And when he was working in Kano State, I was born in Kano. And we also lived in Zaria. I think later I moved to ABU, Zaria, before we now went back to Kwara State. So I was still very small when we went back to Kwara State, where I started my education in primary school. At that time, I didn't start there was no nursery, so I was just in started from the kindergarten or primary one or something like that. So from there, I went to had my secondary education also in Kwara State Polytechnic Secondary School. Then before I now started my university degree at University of Ilorin, where I did medicine and surgery. And after I finished my education, I went back to the north. That's I was in Kaduna where I had my internship. Then I worked at the private hospital, Rimi Specialist Clinic at Gorimi, Kaduna, before I now went back again to Ilorin for my postgraduate training in ENT. My ENT, I trained in different major hospitals in Nigeria, like Ilorin, I trained in Ibadan, I trained in Lagos, before I now completed my residency training and moved back to the north again, where I started working at Federal Teaching Hospital Castina, where I was for the last 16 years before I left for the US in 2022.
Okay. Okay. So when did medicine first appear on your horizon? Was it a calling, a family path, a pragmatic
Yeah,
choice?
yeah, medicine. For me, I can, in our own culture, in especially in Africa, when you are doing when a child is smart, they say, okay, he's going to do medicine, or do engineering, or you do law. But for me, I had a different trajectory in life because when I was younger, as a kid, I was not seeing like to be a physician because I was seeing I couldn't know what I was really seeing as because I didn't go to a nursery school. So I started at primary one, and at that time I didn't even know how to read, and nobody could identify my problems. So I was growing like as a child that has some issues in terms of education. I was not really doing well in school. And until when I was in primary two, when I had to get to primary two, and I was told to write my name from school by my teacher, and my teacher realized that I couldn't actually spell my name or write my name. There was the name. Can you write it down? Because I wanted to write my Muslim name. My Muslim name is Abdul Majid, so it's long. So I didn't know it. And that was at that time you are supposed to know how to write your name. So it was a mom that now wrote my name in the paper and gave it to me to take it to school. So even at that time, they knew my name, but I was not good in class. I always come last in primary four. And my dad now was worried because I was different from most of the children and said, "What is it?" I knew we didn't know what to do, so we now told them that I should repeat that class. So when I repeated class, I now had to learn how to read myself. Nobody was able to discover my problems. I couldn't actually read and write. So I now crammed some book, those English book, like a comprehension book or story book. And when I crammed it, I was able to identify and use it with the Yoruba language of spelling to be able to now able to read. So when I was able to read on my own, I could understand it. Then I was able to apply it to the class. And that first, uh, how do they call it in primary school? Is it first? They don't call it mention. It was fourth term. The first term, I was able
Okay,
to
yeah,
yeah, I came first from the last. So I came
okay.
first in that class because I could read, I could write.
Mm,
So I picked up. So, but even the way I picked up, my dad was still skeptical. I was scared that how could somebody be coming last and now become coming first suddenly? What could
mm,
happen? But nobody knew that that was because I love playing football. I was like playing. So they felt that probably I stopped playing, then I could actually I didn't know how it happened, but I knew that it was the reading that brought me back to life. So at that time, even going to the secondary school, nobody could see whether I wanted to do medicine or engineering or anything. I didn't know that time because I had a lot of things going on with me in terms of friends, in terms of reading novels, and was interested in all these famous five. Yeah, I don't know whether you've read all the
My
Secret
mom said that
Seven.
she used to read it. My mom said she used to read that famous
Yeah,
five.
all those things.
That's
So I
more
was, yeah,
time.
I was reading all
More time
these
than I can remember.
adventures. So I didn't
Sounds
really
like
know what I wanted to
Sherlock
do.
Holmes, that type of
Exactly.
stuff, isn't it? That type of yeah.
Exactly. But what helped me was because I had my senior brother. My sisters were not doing medicine, but they were very disciplined. Yeah, as your mom, they were very disciplined. When they come home, they're always the home reading one thing or the other, working, trying to help our parents and also take care of us in terms of our clothing, our rooms. So they were disciplined. So you could see that you could you could see the mentorship from them. But I have my senior brother that started in science class. So he had a lot of friends from India, brilliant people, different names. So when he comes home, he used to talk about some of these courses he was doing, like physics, chemistry, biology,
Is
before
that
I could
Uncle
start.
Hashim? Is that
Yeah, yeah.
oh, okay?
So I was doing those things. So he had interest in that. So when he comes home, we used to listen to him. We sit with him, tell us stories about his school, his classes. So he was more interested in all those things. So when I had those things from him, and he was I talking about physics, about medicine, if you pass distinctions in mathematics and things like that. So when I started it, it became very interesting to me because I knew my brother used to talk about this. So still I didn't know that I was supposed to use it for do medicine anyway. So I now started I love to do them because my brother was doing them. So so by the time I completed my secondary school, I was finishing my secondary school, my dad because he was a civil servant, so he knew that to get job in Nigeria you need to have connections, you need to do professional courses because he didn't have a lot of influence to be able to get job for people. So he always advised us to do professional courses to do, but it still didn't move me because me have more. I just feel that what do I really like? But I now tend to say, okay, maybe I'll do medicine, or I'll just think, okay, maybe medicine. So from my class, because I love biology, chemistry, physics. So I felt, okay, maybe medicine. So when I now wrote my first jump, I was not able to make the medicine list, but I was taking for agriculture. So
Okay.
I was supposed to go
So
for
for
agriculture.
people who don't know what Jamb is, could you explain?
Yeah, JAM. Because when I did my JAM, I was given agriculture. JAM is Joint Admission Matriculation Board. Is one of the exam that we use in Nigeria to get into university. So I was actually given JAM. I was already given admission to come and study agric at the University of Ilorin. And I
And
didn't mind.
that's
You
after
said?
like YEC. That's like a couple
After
years
YEC,
before YEC.
yeah, after YEC, I passed my YEC. Well, my YEC had not come out that time, so but I was given admission to come and study agric. So I said, okay, yeah, I don't want to waste more time. I just wanted to go to university because one of my brother's friend also did agric. So I felt that, yeah, my brother's friend had done agric, so I would go to go and do agric. Because I felt that well, medicine, let medicine go. Let me just go and do my agric.
Hmm.
Yeah, so I was now waiting for my wife. So, but when my wife came out, my English wasn't good. So they didn't take me in. They said I had to complete my English before I could
So,
actually get into agriculture.
but I thought isn't YEC that was like secondary school education. So like wouldn't you
Yeah,
have
but you
done
need
a
you
couple
need the
years?
WAEC. Yeah, you need the WAEC, and you also need the JAM to be able to
But
enter a
wouldn't you have
university.
done it a couple years prior? Wouldn't you have done YEC prior? That's what I'm saying.
No, you do the same year. The same. The
So
WAEC
is
was
that for
done in June.
everybody?
Hmm?
Is that for everybody then?
Yeah, for you
Everybody
when
had
you're in the
to
final
take it.
year, when you're in final year in high, they call it high school in your place. When you're in final year in secondary school in Nigeria, when you're in final year, that's the fifth year. We used to do
Oh yeah,
55 years. You do both
and
jump.
then you can okay, and then you can do like university like earlier than a lot of other places. Is that correct? Like, do people start university
No,
earlier?
you just do your WAEC before you do your WAEC. Sometimes some people do WAEC in fourth year, but they will still not graduate until when they did the fifth year
Okay. So how
secondary
old were
school.
you basically then
Hmm?
at that time? How old were you at that time?
Oh, I can't really recall at that time, but I should be about 17, 18 years or something like that. When I
Okay,
was
yeah, cool.
graduating secondary school.
Yeah, apologies to interrupt. You can just continue
You
about
said?
yeah. Apologies for the interruption. I said.
No, no, that's okay.
Yeah.
So I did that, and I wasn't able to get into agriculture, so I had to go and do my A levels. And that when I was doing my A levels, that was when I now knew I really wanted to do medicine. So I now changed. I now knew I didn't really wanted to. That was when I now did my English, and I did my A levels. That was what I now used to enter into medicine at the University of Ilorin Medical School. That's what took me to me. So you can see that uh, decision making, I was really going like that until it took me up to A levels before I really knew that, okay, it's medicine that I really want to do. And I'm fortunate to be able to get into medicine at the University of Ilorin. If I'd got into agriculture, if I'd not had issues with my English, I would have gone to agri.
So that
I
would have
wouldn't have
been
been,
like
I wouldn't have been a doctor today.
okay. So what
But
would
because that
what
time I
would
was
you
not really sure, I was just going with what my brother was doing.
okay?
Until
Was
when
this
I
like
got to
was
A levels, hmm?
no? I'm just thinking about like the timeline. I'm assuming was this like the 80s or when was this or
Yeah,
70s?
that was in the 80s, late 80s. That was in the
Okay.
80s, late 80s, yeah.
So what was the
That was
economy
like
like?
89. That was like 87 was when I did my work. 89 when I finished my A levels.
Yeah, because what was the economy? What was like the infrastructure of Nigeria like? Because like agriculture is not necessarily something that I hear people kind of
That
what was
time if you do that time when you do agric or you do, it's not like going for agric to be practicing. People just go into it. When they finish, they go into banking. Banking was just coming up that time. They go into commercial banking. When you do agric,
okay.
they do animal husbandry or agric economics. But they just called in it. Most of the Nigerian education at the time was just mainly just get degree.
Okay.
And when you get degree, you go and look for government job, then banking was coming up. People go into banking. But I was not even thinking of what job am I going to use it for. I was just thinking that bank. I just felt that Greek too was good. People do it, and my brother's friend was doing it. But when I started my A levels, that's when I now started loving. I started knowing more about medicine. That is what I really wanted to do, and I was able to get it after
Okay.
after I finished my A levels.
Okay. Okay. So, um, what was it that like drew you? Was it like a passion or like, for example, what was the pivotal decision point like to?
Yeah, because I had my cousin too. Also, my cousin was also doing. He was he's a very brilliant guy. Bashir is a pediatrician now. But he was more of mathematics, and he was very good in mathematics and advanced all this hard channel mathematics, physics. But because he was brilliant, I told you when you are very brilliant, you go to medicine. They said no, you are supposed to be a doctor. But he had in his personality also he has compassion. I think it's part of him. So I'm sure that's why he went into to do medicine. So when he got into medicine, he used to come and look for me. We were close as my cousin. So also he inspired me to go into medicine that time.
Okay.
It was like my cousin and my dad and his dad were close. So like me, most of the things I do, I used to take it from people I really love, people I care about. So when they're doing something, when I like them, I love what they do, and I try to see uh, whether I really love to do them. So medicine has always been around from my brother, my senior brother, to my cousin, and I was able to live around that for me to be able to discover myself.
But doesn't uncle he works in like pharmaceuticals, doesn't he? If I remember
Yeah, I
correctly.
wanted to do medicine too before, but he was
Okay.
able to get admission into pharmacy, and
Okay.
he decided that pharmacy was also good, so he went into pharmacy, which is also professional job. So
Okay.
that's why
Cool.
he did pharmacy. Mm.
Okay. Okay. So it sounds like things like, let's say, like it's a vocation. Like you have to be passionate, as you said. He has compassion for people. So like
Mm.
this is okay. Let me ask you this: what does the Hippocratic Oath mean to you?
No, Hippocratic oaths, it's just an oath that's for physician that you take way before you practice. And, if you look at it, I, as a physician, when people take the oath, they don't even know what it's all about. You need, as a physician, you care about life, you care about people. It's not any oath that make you to show who you are to people, to show empathy, to be compassionate, and treat people as if you treat yourself. And also, you have to be very intelligent, very smart to be able to identify people's based on your training, what needs to be done, and how you can save lives. So, Hippocrates, you cannot discriminate. You must treat people with fairness, and you must also be able to treat people the best way you are supposed to be able to treat. So you don't really need an oath per se to be a physician. You just have to be somebody that really care to take care of people. But you still need people need to still take the oath before they go into that to take the oath officially to be able to say I want to treat. And not so that people will not see human being like an object. They have to see them as human that they are treating life and saving life.
Okay. Okay. Cool. Um. So going on from the medicine thing, I would say the subject of medicine shows it. When did you decide to go down the route of like let's say surgery, for example?
Yeah, I when I was my third year in medical school, I had um that time I was not sure of whether I just wanted to be a doctor. I was not sure whether I wanted to be a surgeon or a physician or pediatrician. So because that time we was still doing our basic sciences and dissecting human body to be able to show what part of human body is responsible for what. So, but that time I was not able to hear very well in class. I had my hair was blocked and I was very feeling very discomfort. I heard like sounds and distance. So I didn't know even who to see. But I was still going to class, and so at that time I now went to teaching hospital from the permanent side. I went to see my cousin because I know I had it. I knew there was a cousin. I have a cousin that is a physician and is working in a teaching hospital. So I went to meet him in his office. So I looked for him and I was able to find him. His name is Shegun Busari. So when I met him, he was sitting on in an office in a chair. I've never seen that type of chair before. His chair is like those suede chair that has tires, that has rows, that he would now moved around on the chair. He had a light on his head. Then he had some nurses with instruments. I was wondering that, and he was wearing very tie with work coat, looking very nice. I was still far third year in medical school, so I didn't even know what area was he. So now he now asked me what to. I now told him that my hair was blocked, I couldn't hear, and I was having some noise, and I was having hearing loss. So he now said I should sit down and then use the light. He rolled on my lights, my ears, and he used some instruments and held my ear. Before I knew it, my hair was clear. I could now hear very well. I could hear sounds. I was not hearing noise. Everything just became perfect. I was wondering that what type of magic is this? I was looking at my cousin that how he was able to do this magic. So I said, okay, maybe because the physician, so I went back to school. So I finished up. I think when I was just about to finish my school, I went to visit your mom, and he was serving in the same place where your mom was working. He was serving the state. Oshobo, he was serving there.
Yeah.
The same, yeah, this guy that treated me that time, my cousin. So he was serving there. So I stayed with him for like a week where he was serving before I went back to school. So when I stayed with him, I saw a different person that I really love. He was so kind, very compassionate, very simple and humble as a physician. So I saw a lot of things in him, and I now asked. That was when I now knew about what he was doing and what he did for me, and he now told me about his specialty as an ENT surgeon. So I now fell in love because of the way I really see him as an extraordinary person. I now took interest in what he does. So when I finished my medical school, I knew already that I was going to do exactly what he did, ENT. So I knew that was what I wanted to do. So I was not even beating around the bush trying to find what I should do. I knew I was going to be like him. So that was how I went into surgery. So when I went into surgery, it was another path I took to be able to go into a subspecialty of hearing care. It's another story of that for me to be able to find myself in the niche where I am.
Okay.
Yeah.
Yeah. That's cool. Yeah. That's lovely to hear.
Mm,
Um, I guess I had another question about the key people, but
mm,
um, it seems that you've mentioned who's kind of shaped your formation.
mm,
So I'll go on to the next section. We'll talk about let's say yeah, the training and the specialization, and then after that we'll get into chess. So obviously you said that you studied at University of Ilorin, but could you walk us through your medical education, how it worked, where did you train, and what were those years like? What was the formative years like?
yeah, yeah. I would say I'm one of the lucky people that had the training in Nigeria when things were a bit good because our training was virtually supported by government, was almost free, both in medical school and residency training. Because when I went to what happened was that when I finished, I was working. Things were difficult. That everybody was going abroad. My junior brother, we trained together, left the country. Everybody was leaving. Your mom was in the UK. She had left for the UK that time. So the when I finished my house job, my service, and I was working, Where I was working, the doctor is also supposed to go to UK. He trained there, so everybody was just leaving. So that's why I now said, and things were difficult because the doctor healthcare were not being cared for by the government. Though they train us, but they don't care. The government were not really paying attention to doctors that they train, how they live, how they be able to be comfortable to be able to do the work, their welfare and things like. So a lot of doctors were leaving. They find a way if they can find a way they leave the country. So actually, I wanted to leave that time, but I was skeptical to leave because of my parents, because our parents were still here, and my brother, my junior brother that we did medicine together, he has left, so I was alone. I was left in Nigeria, and I was being skeptical to leave because
And
my parents
that's
were
the
here.
uncle that you're staying with now. That's who you're referring to, Uncle Will.
Yeah, yeah, Bolaji.
Yeah.
So he left. That I went came to visit in. So he left earlier. So and I stayed. I wanted to go to UK to meet my sister so that I can now start my career there because of the way things are. So I went for a visa interview. There was one guy that was he was like close to the governor of CBN in Kaduna at that time, and I treated his family. So he said he was going to help me to go to UK. So he collected my passport. I should, when he's going for holiday, I should follow him and things like that. So when I went, he took me for the interview, but I was not given a visa. So I was very happy because I was not given a visa. I was like, I won a jackpot. So I called your mom that I was not given a visa. I'm going back home.
A
So that
lot of
was like,
people would be the
and that time I
opposite.
had, yeah, and that time I had a, that time I was already had a job to come and do postgraduate in ENT. I was already given a residency position in University of Ilorin. So I just said, let me go for this interview. Then God will decide for me which one am I going to do, whether I'll go to UK to like any other doctor or I'll go back home. So when I didn't get the visa, I was so happy when I was going back to take my job to my job in to go home because I was going to pick my things in Kaduna and go back to Lorry. And that was how I ended up to start my residency training in Lorry. So residency training was a bit difficult because that time there were very few ENT surgeons in the country and infrastructure was very limited. But we had very good teachers. Also, they were not. Hmm?
Sorry, can I just interject because I feel like at that time in Nigeria,
Hmm?
the mindset would have been like completely the opposite. Like people would were willing to go to the like the furthest extent to leave the country, like to get a visa. So what was it about your mindset that it was the opposite of that? What would you say?
Yeah, I felt that like me from time, I felt that fine, it's good to get a good job, but the way people, if you travel, the process, first of all, either you don't have the right papers to travel to South Africa or go to the UK, then you now start and try to look for papers to be able to stay there. One and before you can even have time for your parents, my parents were getting older. So, and we have not, since I finished, I went to Kaduna after I finished, my brother left. So that's why they produced two doctors, but the two doctors were not even there to take care of them. So I felt that it was good for me to go back and take care of my parents, to stay closer to them and take care of them. And when I got back home, that was when I discovered that my mom was diabetic, my dad was hypertensive, but they were not checking. They were not checking. They were not checking. Not just like people that don't check their BP. They are the physician that was not really paying attention to my dad's health. He just say, he told me that that's the thing my dad visited me when I was the registrar, and I checked his BP was very high. And I asked him, "Do you know that your BP usually high like this?" He said that sometimes that is primary care physician told him that his BP just high anytime he has malaria. You can imagine that. And the BP was very high, very high, up to 200. That I didn't even, I just told him to go and meet his physician. So I now make sure I got him the cardiologist, I got him screened, I got his health back to normal. Then also my mom, I when I saw her that she was uh, she wasn't sick, but I thought that she had lost some weight. And when I got back, and she told me some symptoms she was having. We just discussed, and I knew that so let me check her, let me do her blood sugar, and I see that her blood sugar was very high. So, and she didn't know. So I now started seeing, let her see endocrinology. We started seeing a very special physician, Dr. Larry, in teaching hospital, who will control her sugar and make her okay. So
So
those are some
sorry,
of the
I just
things
have
that.
to pause for a second.
Okay, all right.
I will
Okay.
we'll edit this, but yeah. Do anything, but to be fair, I didn't want to stop the recording
Mhm.
just in case. But I will just edit this. Yeah. Um. Yeah. Sorry about that. So where were we?
That's fine. Yeah, I was telling you about, you were asking about the residency training and how it went, how I was able to start it. So I was telling you why I came. Yeah, you were asking me how I decided to stay in the country, how I started my residency training. So, and why I didn't go abroad to like every other person. So you were asking me that. So, and I told you that I stayed because of my parents, and as because we are two physicians, one has traveled. I was the one left. So though at that time I was not sure whether I should go or not. But when I didn't get a visa, I was happy because I was able to choose to stay at home, so I can train and take care of my parents. So I was able to, when I stayed at home, I thought I was able to discover that one of them was hypertensive, one of them was diabetes, which was one of the things that also made me happy that I stayed at home. Because if I had gone abroad, it would take me some years to settle, and they may develop complications without anybody discovering it. So by my coming home was like preventing them from developing complication because I was there to check. Because nobody is going to check for you
Yeah.
except
Especially
you
like your
check.
family, like and family. Yeah.
Yeah, nobody's doing, because their awareness was not really there at home about physical check and checking. Except people just go to doctor when there is problem, when there is
Yeah.
complication. They go. That's when they're already bedridden. People on the way, people don't go for to know whether this is an issue that is going on. People don't know until when there is a big problem happening.
Okay.
Mm.
There's a little bit of echo in the background. I don't know if something has changed.
Like call?
Like I can hear myself from your side.
Okay, I don't know. But was this what of now? Because this one is not. Can you hear now?
Um, let me speak. Testing 1, 2, 3. I can't hear myself anymore.
Let me use this.
No, but I can't really hear you anymore.
Okay, maybe it's this. Wait, let me see. I think
Oh yes,
it's.
switch track.
Let me disconnect my phone from it. I think it's my phone. What?
Yeah, yeah, yeah. It's gone back to Mac, but yeah, let's continue. I can still hear myself a little.
But before, were you hearing yourself before you cut?
It was after I took the break, the little break. When I went away for a little bit, that's when I started hearing.
Okay, let me see now. Let me see what I, because I put this one in my ears. They were connected before, but I'm just wondering. They were connected before, but I let me see. Can you still hear yourself?
Testing 1, 2, 3. Yeah, I can still hear. There's still a
Let me
little
see
bit.
now. I'm coming. Hello?
Hello. Testing 1, 2, 3.
Okay, now I
No, I
can't hear
can't hear
you
myself
again.
anymore. Oh, you can't hear me anymore.
Wait, I'm coming. Hello?
Yep, testing 1, 2, 3.
Can you hear me?
Yeah, I can hear you.
Yeah.
Can you hear me?
Yeah, I can.
Can you hear me? Okay,
I
yeah,
can
there's
hear you.
no more. Yeah, there's no more background noise. Okay. Yeah, cool. There's still a little bit of a hum, but it's fine. Is the fan on there, or is that maybe it's the computer?
Yeah,
What's the
maybe.
temperature? What's the temperature like there?
Oh, I don't know. Let me see on my phone.
Has it been warm though, like temperature or?
No, it's not warm. The temperature is okay. It's okay. It's maybe about 51.
I don't know. I work in Celsius, not Fahrenheit, so I don't know.
Okay. It's not.
So that's yeah. I don't even remember the calculations off the top of my head. But okay. Okay, so that makes sense. So you must have seen it like kind of like the will of God, like qadar. Like, is that how you kind of saw it? Because you said that.
Yeah. I would say that is the will of God. That yeah, the will of God. Because sometimes I think it's just God that make decision for you to know. Because I would have traveled too, but I still had to stay. Then when I now came back, I was able to start my training. I was able to start my training close to my parents and my family, my brothers. I was able to be there for them. And I also got married at the same time. Then I started my residency training here in Northern Truth.
Okay. Yeah. So.
Then the training, you were asking about the training. The training was a lot of issues because of infrastructural problem where we had good trainers and we had to travel to different centers to train because finished. It took a number of years.
Was this after med school then? So this was after med. No,
Yeah,
before
after
med
med
school.
school, after I worked for like 2 years, 3 years, then I started training.
So when was this? Was this early 90s or?
Was it 2000? It was 1999. I started this training. 1999
Okay.
September.
Okay.
That's when I came back
So
and I started my training, and I finished the training in 2006. I became an ENT surgeon in 2006.
so that's just after like kind of military
Six.
governance had ended, so to say.
Yeah, military governor ended in 19. It was 1999. It was 1999. Was it not 1990? 1999. That was when civilian government started. Yeah.
And so that's when Obasanjo came into power.
hmm
Okay. And
So
in
I was in.
2006, by then was Yaradua in power by then.
No, yeah, yeah. I think so. Yeah, 2006. What I knew when I took a job in Katsina 2008. Yeah, that was the president that time. I think it was about he came into power around that 2006 or something like that.
He passed away in office while he was in office, didn't he? If I remember correctly.
Yeah, that's the president. Yeah,
Yeah.
I was working in the States that time when he passed away. I was working in the States in Katsina State
Okay.
as an ENT surgeon. Yeah.
So there's other things that I've written down. You completed the ICIT International Surgeons course, an advanced cochlear implant training program. What prompted that investment, and what did it change for you?
Yeah, my cochlear implant program were staying back to those are specialty in ear and hearing care. Like when I became an ENT surgeon in 2006, I was in National Eye Care Center. I didn't take a job because I was trying to improve my training through post fellowship training. Then I went to India to start trying to develop myself and see which area do I want to specialize on. Before I now came back to Nigeria in 2008, that's when I picked a job at Federal Teaching Hospital. It was Federal Medical Center, Katsina at that time, when I picked a job as a consultant ENT surgeon. And I was the first ENT surgeon in Katsina State, in the states of about close to 10 million people. At that time, there was no ENT surgeon that took a job there, and there are very few specialists in the hospital. So I started to develop the ENT in that area, and I now have special interest in ear and hearing care. So what happened was that during my trip to India, I saw some children that were deaf that was giving they had surgery, and they were giving their hearing back. Some were born deaf, some developed deafness while they were a child, and they had a cochlear implantation and they were given hearing. And they can now speak, they can now hear, they can now go to school. It was at Madras ENT Research Foundation in Chennai, India, and that was the place where I was training. So when at that time I had interest in such a thing, and I said, oh, why can't I used to see a lot of children in Nigeria that go deaf, some of them are born deaf, and we were not able to do anything for them. So I was so interested in doing what I saw in India, in Nigeria, and those are the cochlear implantation, this thing that I talked about. So the Indians came to Nigeria. I was able to bring them to do the first international conference of otology in Katina, and where I was able to bring a lot of ENT surgeons to see how children that are deaf can actually be given hearing back. So we had been exposed to training, and I was able to take the kids to India back to train people around it and train myself to be able to do these surgeries. So there are a lot of surgeries apart from cochlear implantation for deafness and hearing loss, which I was able to do a lot of training through that. So one of the training that I did, especially before I came to the US, was the International Cochlear Implant Training, the one you see. That was in the US. It was a center in the US that trained me to do that. And where we had the training, it was just too hard to do all the training I've had at my cochlear implantation fellowship in India. And from there, I also had other training in the US and otology at Emory University before I now started doing global health and public health. And my major now is in global hearing health. That is what I'm also doing, and trying to build capacity in Nigeria and improve access to hearing care across the low-income communities.
Okay. We're about 50 minutes in. I think obviously the niche of this, we play chess while we.
Yeah.
I've been informed that you're a bit of a chess player yourself.
Yeah, I play chess, but I'm not champion of any state. But maybe I can beat you. I can try.
I will send you the link now on
Okay.
via email. So
Okay.
and we'll just continue, but maybe I'll put a time in.
Hmm.
As in, maybe I'll use the chess clock, but yeah.
Yeah, it's okay.
Okay. So when are you going back? I'm gonna edit some of this stuff out. So
Yeah.
But when are you guys traveling back?
We're going back on Wednesday. Salah is on Wednesday, so we're going back after we start. We start the Salah celebration here. We finished in Georgia, inshallah.
Okay, so is uncle coming back to Georgia as well? Is family coming to Georgia?
We are in Georgia. No. He's not going. It's me and Kabir that we came. Me and Kabir were here together.
Are they gonna go back for Salah as well?
No. We do Salah here in Illinois, in Georgia, in Chicago.
Oh, okay.
And me and
So
we'll go back home. Uncle Moyo is in Georgia.
Okay. No.
It's not all of us there. Just me and Kabir alone that came. Uncle Moyo is in Georgia.
Okay. I saw on his birthday, you guys you went to like a restaurant or something.
Yeah. We celebrated his 50th. Yeah.
Like a saxophone player or something. Morning.
Yeah.
Auntie, bro,
Aisha, yeah.
That's crazy.
I thought I just saw the saxophone.
Yeah, I've sent you the link. Let's see if it works. you received it?
You send me the link now? Okay, let me look at.
Yeah, yeah,
Through my email?
yeah.
Yeah, I've received. What should I should just join it?
Yeah, just click on it.
Yeah, I'm there now. I've clicked on it. I'm not. Is it? I didn't see any chessboard.
Let's see if it's
Okay, let me check again and see.
yeah, because I started it a while, like a little while back. So let's just see. So you put the link in to think.
I didn't see the link. Any link? Let me see.
It should say Lichess.
You say what?
Lichess.org.
In the email, I didn't see any email like that. Which email did you send it to?
Olayinka Suleiman. Outlook.com.
No Outlook. Don't send it to Outlook. Send it to Gmail. I don't use my Outlook. I don't know.
Sorry,
I've never used my.
that's my bad.
Send it to my Gmail. Yeah, 12.
Okay, cool. Nice. I think that's just because that's where I received the thing from.
Yeah.
Okay. Yeah. Thank you for coming on as well. I really appreciate it.
You're welcome.
Okay. So is everybody else in university, like your other, like Ali and Taria, they're in university right now?
Yeah. They're in the university too.
Okay, so that's why. Was it? What? So you guys just decided to travel yourselves, or?
Yeah, I just wanted to come and see my brother. With Kabir too has finished his exam, so he's graduated. So both of us just decided to come and spend 3 days and go back. Just holiday. So actually, I give me opportunity to rest and do some thinking, to explore some of the things I've been doing, see how I can do them better, and
I've
also
sent it
do
now,
some
by
work.
the way.
Okay, let me see. I'm still waiting. I've not seen it. Is it to Ika Suleiman 12 you sent it to?
Yeah, it hasn't. I haven't seen it in.
In sent message?
Not yet. yinkasuleiman12@gmail.com. Yeah, it should be.
It doesn't come.
Should have sent now.
How is Ayobide doing and his wife?
He's fine. It's her birthday
When?
tomorrow.
Oh, so where are you guys going to?
He's holding. No, it's her birthday today. They've got like. He booked like a dinner and like a lounge and like doing like a little party.
Okay.
Yeah. So, yeah, literally.
Are you guys going?
Yes. Yeah. It's sent, by the way, but yeah, we're all going. Have you received the email?
No, yet.
Sorry, I just want to make sure that everything is okay, so that yeah. Is it there or?
No.
Worst case scenario, I don't know if your phone is connected to the MacBook. I can just
It's connected. Let me see. Can you share it? If you send it by
I I can share my screen and then show you.
Yeah, you can share your screen. Yeah.
And then
Or if you share your screen, will I be able to play with it?
you can scan the thing. You can. So I'm just trying to see which. Okay, can you see that? If you scan that barcode, it should be alright. Oops.
Okay. Yeah, let me scan it. So I can play it with my.
Oh yeah, that's alright because I will record on my side anyway. To be fair,
You say what?
It will record on my side. It will record the chessboard on my side.
Join the game. I've joined them.
Yeah. Okay. So yeah, let's get back to. Wait, I think the screens are on okay sides. Yeah. So I just want to see my question. So I guess it's not really it's not gonna be like timed. We'll just play and go. But I just want to see how like you. I feel like medicine it requires you to have both like good powers of deduction, reasoning, pattern recognition, and stuff like that. So I just wanted to kind of examine how you think and like talk to you. I don't know. Would you concur with that? Would you agree with that?
That's fine. That's fine. But actually, it's just many people that play that doctors they may not know how to play chess. I was just you just find yourself to be able to play. You can may interview some doctors they may not have played chess before. But actually, reasoning is one of the major aspects of because you have to be able to reason with as if being a physician. Actually,
yeah. My dad's brother, he plays a lot. Like my auntie said that he plays a lot as well.
the doctor.
The one in yeah.
Oh yeah.
I mean, there's two. No, the older one. Shingo.
Oh, the other guy. Well, your dad too played a lot of chess when he was in college, isn't it?
Oh, okay.
I heard that he's a very good chess player too. Your dad.
Okay. Yeah, Uncle Shegu plays a lot.
Okay, plays a lot of chess. Yeah.
That's yeah. So I heard. But okay, yeah, I'll start off.
Okay.
Cool.
You start off. So I'm using black.
Yeah.
I'm using this.
Yeah. So what was it like in India? Like what was it like in Chennai, India?
In Chennai. Okay, I have to use my phone, isn't it?
Yeah.
Okay,
yeah,
let me use my phone. So I've not seen your first play. Your first it's not showing on my phone. Okay, okay, I've seen it now. I've seen it. I think it's connected back. Yeah, I've seen it. Yeah, go from.
Okay. Is that convenient for you? Are you happy with that? Like
It is. It's convenient. Yeah.
Okay. Yeah. What was it like in India?
In India, when I went to India was a beautiful place. I decided to go to India because I wanted to have a place that has some form of resemblance to Africa in terms of let me just take the first move. That has in terms of culture, in terms of level of here in India too, we have various classes of people. There is also a number of people living in poverty. There are different things are not like developed countries, still are also a developing country. So, but I like their culture. They're nice people, and the fact is that they have a lot of big hospitals and very skilled in a lot of medicine is advanced in India, and there are places where we can places like Nigeria can develop can advance our healthcare system learning from India. That's why I decided to go to India for that. India is wonderful. The time I went with my children, that was why I taught them I was able to put them through how to swim because they
Okay.
had a training and all of them were able to swim when I went with them. During my training, I went with my family at the time. Yeah,
Okay. Yeah. Oh, so did you go more than once or?
I went to India many times. The final
Okay.
time was when I went with my family, when I went for my fellowship. But I was going a lot of, almost every year I go twice, sometimes I go 3 times to India.
Okay.
For
Okay.
8 years, I was doing that.
By the way, it's your turn as well.
Hmm?
But it's your turn. It's your turn.
Okay, have you played your second move? Your third move? Let me
Yeah.
see. You played,
Yeah.
yeah.
I
Okay, I've seen
moved.
it. Hmm?
I moved the knight.
I've seen it. Hmm?
Okay. Yeah. Okay. That's interesting. To be fair, I mean, I guess it must have given you a new lease of life. But
Yeah.
speaking of like kind of development and stuff like that, and like being in a developing place, could you describe the gap between what you were trained to do and what was available to patients in Katsina? What does that gap look like on the ground?
Um, in India and Katina, that time there was a large gap because that time we didn't even have any. When I was there to train in hearing and hearing, and we're supposed to have a diagnostics, we are supposed to have a place where we'll be doing surgeries. We are in terms of equipment, and we're supposed to have people that are supposed to know how to make diagnosis, measure hearing loss, and things like that. So,
Okay. Okay. Um, what? How do you stay current in a rapidly evolving field when one is not based in a major research hub?
yeah, you say what?
How does one
How do I
stay
say
current?
current?
Yeah. Yeah.
Yeah, the way you stay current is that probably you have to be, if you are not a researcher, you have to be you have to attend conferences. If you are not, you attend conferences. You may not even write, but you just attend some conferences, either international conference or you attend have you made your next move? No.
Yeah. Yeah.
Okay,
I
you played
captured
there.
the I
You
captured the
played.
pawn on e5.
Oh, you captured the pawn.
Yeah.
The one I was supposed to use to capture you.
Yeah.
That's interesting. And you want to go for this pawn and check me.
I don't know if there's a way of putting it on the computer. I'm trying to. By the way, you don't really. You can just focus on the game. You don't need to look on the camera. Like if there's
Okay,
something.
I'll be talking to you. Yeah.
Yeah. Yeah. So, so it's by going to conferences and stuff like that.
Yeah, I go to conferences. When you go to conferences, you will move and you'll be able to see a lot of work going on. And that time you'll be able to do a lot. And But apart from that, you can also be doing your research work, or you can also read journal articles that are out without going to the conferences. You will look for those journals and read them. Then you get updated on your area of interest. You look for those journals and read. And other things that locally, you can also be where you are working. There are a lot of academic programs that goes on, like presentations, weekly auditing, mortality reviews, journal presentations. They happen in the centers where you work. Then you can get update from there too. So I think there are a lot of ways in which you get updates.
Okay.
For me, I'm just trying to get into. Before I was not interested. I was not interested in joining a university, but I love research. But I didn't have a structured research training as both in my residency, my medical school. So, but I apart from the fact that I did some book writing, I wrote some book at my fellowship, but the structure and the training and research, understanding the principle of it was not really. I didn't have the good capacity in that. So, which is what I'm doing now at my graduate study training in Emory University.
Okay.
So I'm going to go into research. I'm going to build research and using data to change policy to improve healthcare in Nigeria. Yeah.
So you're moving more hands off then?
Yeah, I'm still going to be doing hands-on. I'll be combining hands-on with research, mentorship, humanitarian work, and lots. I'm going to work on all the things I've learned over the years and put them together and see how I'm going to make impact to them, in the long run.
Okay. So for the audience who may not know, what is a cochlear implant and what does it actually mean for a person who receives one?
Yeah, cochlear implantation is a device, electronic device that is implanted it's a treatment for children or people with profound hearing loss. And profound hearing loss are hearing loss that have reached hearing loss, we grade hearing loss from mild, moderate, severe, profound hearing loss. The mild hearing loss, you want to take it from, depending on the WHO criteria you are using, the level of, just tell you about the level of hearing loss that somebody is already losing hearing, and maybe somebody is hearing at 30 decibel for mild. Then if you are looking at a very profound loss, that means the hearing loss is above 75 to 90 decibel. You're already having severe to profound, but more than 90 decibel. So in that type of high level of hearing loss, you will see that at that time you see that the person, even when you shout, the person cannot hear, and the person doesn't respond to use of hearing aid. So you now know that those patients are they are qualified, they're eligible for cochlear implantation.
Okay.
So and cochlear implantation is now is a device that is used to electronic device that is implanted into cochlear. Cochlear, that means you have to find out where was, I don't know how to explain. Okay, let me start like this, because for audience, the ear has three parts.
Are you trying to show your screen or are you trying to show it or something?
No, I'm not showing my screen. I'm just explaining. If there is opportunity, we would have loved to show you diagrams where to be able to explain the.
You can potentially share your screen as well, to be fair, potentially. So.
Yeah, I don't have the picture here, but yeah, you say?
I've moved, by the way. So.
So maybe if I know, I will have had some pictures so that I'll be able to show you those areas of some pictures that may be helpful. Let me see.
But yeah, it's your turn to move and chess.
You said
It's your turn, chess.
to move. Okay, let me see.
Yeah. I don't know if I'm sure
What
it
did you
shows
take
the
now? What
screen.
did you pick? You picked my.
I moved the bishop to defend the knight. I don't know if that's the
Okay.
best move, but so would that be like um could somebody who's suffering from like maybe like tinnitus, could they require a cochlear implant?
Yeah. It depends. It depends on the. Actually, it depends. Like I was saying, that cochlear implantation is a way of treating profound deafness, and which the cause also has to lead to like a sensory neural hearing loss where the cochlea is already damaged. So you are bypassing the cochlea
Okay.
to give hearing to the brain,
So
because the part of hearing is that it goes from external to the cochlea down to the brain for somebody to hear. But when the cochlea is damaged, you put an implant in the cochlea. That's the cochlear implant that now is an artificial electrode that is put there that now take the hearing across the cochlea to the brain. But sometimes somebody has tinnitus from the damaged cochlea. So by replacing the cochlear hair cells with the electrode, you may be able to give hearing. But that means tinnitus is not, it's just another symptoms attached to the hearing loss. But tinnitus alone, you cannot be doing cochlear implants for tinnitus alone, because if the tinnitus is just there, but the hearing is good, you can't do a cochlear implant at that time, because the tinnitus can be caused by other things, not from the cochlea. But when the tinnitus is from the hearing loss, from the cochlear damage, then replacing the cochlea with electrode can also solve the problem of tinnitus. Did you get what I'm saying?
yeah. So that's just
That
like a
if
symptom basically.
Yeah, it's a symptom. You got it. Symptoms of hearing loss. But if it's a symptom of something like, well, somebody can have tinnitus from middle ear problem, from wax impaction, from infection of the ear, from other things. From it can even be psychological tinnitus. So in terms of that, or somatic. So in terms of that, doing a cochlear implant will not solve it, except tinnitus is related to the cause of the use of cochlear implantation.
So how does it differ from a hearing aid, for example?
What?
Like
A
cochlear
cochlear
implant.
implant. Yeah, a cochlear implant, yeah, that's what I'm trying to tell you, that you do a cochlear implant when the hearing aid has failed to give hearing. Hearing aid only augments hearing. When hearing is, like if you have a hearing loss of moderate to severe, that the issue is between 50 and 64 decibel, according to WHO hearing loss classification. Somebody has a hearing at 50 to 64. The person from that below up to mild hearing loss of 21 to 35, the person can benefit from hearing aids. But when the hearing loss becomes so severe and is above 79, is already becoming a profound loss, and hearing aids is not helping, then the person goes to use a cochlear implant. So hearing aids only augment, it increases the sound so that the person can hear. Just like when you are talking to someone and you shout, but instead of you to shout as an individual, the hearing aid do the shouting for you, for the person to hear properly.
Okay.
But cochlear implant doesn't shout. Cochlear implant is a create a new hairway, the electrode that now replace the damaged hair cells. That now just through electrical activity, the sound is transferred to the brain through electrical activity. But with hearing aid, it transfers it by augmenting the sound through mechanical. It just increase the sound that enters the ear for the person to hear. But for cochlear implant, it's an electrical device. It's through electrical activities that it amplify the sound.
Okay. It seems like, are you not too? Do you want to continue playing the chess, or is it hard
Yeah,
to?
because I'm playing it, but just that let me just play. Let me just play I'm playing just that because we are talking and let me just play. Let me go this way. Why is that? This is your. It's one more like this. Okay, no, this is not bishop. Oh, sorry. Trying to use my bishop.
Okay. To be I don't know if that's the move I would have made, but so let me ask you this then. What is the? By the way, I moved. I captured your net, but what is the state of hearing impairment in northern Nigeria? So like numbers, causes, and what are children and adults navigating?
Yeah, in northern Nigeria, there could be. Yeah, the prevalence of hearing loss in. We are playing chess now.
What?
Is
I
that
play.
uncle?
The playing chess on the. So one more chess playing. One more chess playing.
So you don't know I play chess.
Wait.
We are playing chess and he's a real coach. He just that he was. You come and talk to him. He's here.
When did you start playing chess?
Hello.
I don't know that I play chess. You don't know that I play chess when you were in school. We're still having the interview.
Ayakule, how are you? Okay.
I edit it.
Maybe I'll interview you.
How are you
We
doing?
edit it. We edit the part.
You're doing good?
Yeah, I'm good, uncle. Maybe I'll interview you next.
I let them know, man. They're going to be at night time over there. Yeah.
So
So,
Okay.
we're almost done now. Is that not mosque? Is that not prayer they are calling?
oh, is this not a convenient time? Do you want to take a break or?
No. It's fine. Let me.
Okay. Yeah, you said what's the state of hearing impairment in Northern Nigeria?
Yeah, the prevalence, like the data for Nigeria is actually there is no much data available comparing the hearing, but globally there are about more than 6 billion people are living with hearing loss across the world, and out of that, more than 430 million people require a sort of treatment. Looking at coming down to low and medium developing countries, coming down to Nigeria, the data are not really there. These are WHO data, but there are some data in Nigeria spotted prevalence studies. Some have recorded up to 23%, like in northern part of Nigeria, 13%. Then early time Nigeria, there was a study that shows that it was like 7% of prevalence of hearing loss. But it's just like it varies depending on there's not been regular data that covers what is happening entirely in Nigeria, but a number of people are living with hearing disability across every region of Nigeria.
Yeah, because those numbers that you mentioned, those are like big. Like, did you say 6 billion? Did you say?
About 6.1 billion. Yeah.
So that's most of the world. That's
Across the world, yeah, globally have some degree of hearing, and this is supposed to increase. Is it 6 or even 16? Let me check. My data prevalence of hearing loss, WHO. I think we have. Is it 16 or 6? Yeah, about 1.5 billion. Just for 1.6 billion supposed to be.
yeah. Okay, yeah. I was
I
thinking,
have
I was
some.
thinking that
Yeah,
was
it's
like most of the world.
1.6 billion. Yeah, 1.6 billion. I live with some degree of hearing loss, and among them, about 430 million people have disabling loss, and by 2050 they expect to increase to 2.5 billion people.
Okay.
So in Nigeria, we have the number is not really because of the prevalence study in Nigeria. It's not been. Let me check in Nigeria. In Nigeria, so exact prevalence is not fully established because of lack of data in Nigeria, but they have approximately about 8.5 million loss of people living with a level of hearing loss, according to some studies. Generally, this one was scientific research on social effect of hearing loss in Jos and Central Nigeria. This was done by Benjamin and Bako. A study that was done there, and he stated that the more than 8 million people are living with a level of hearing loss in Nigeria. So it's a big problem that is a big problem that requires attention.
Okay.
Let me see whether there's any value.
What about like what you were seeing as you were like for example, you were the director of the hearing mission at the Suleiman Hearing and Education Foundation.
Yep.
What is Chef Nigeria, and how did the foundation come to exist? And what would you see? I guess obviously the facts and figures are kind of, they vary, but like what did you see personally, and what did you do as a director?
Yeah, because I was specialized. I specialize in hair and hearing care, and I love to help people in low and medium income sector to improve access to hair and hearing care. I was working as the government as an ENT in Federal Teaching Hospital Katsina, but it didn't give me the leverage to be able to do a voluntary work, and so I joined Rotary International, and I was also. Because anytime I wanted to do a free service for people in the hospital, they had to pay, and I have to be looking for people to support them and also pay in the hospital. So for me to now do it as an NGO, I can get a facility to give us the space free. I can get volunteers to use without paying, and I can do the surgery myself. So it's reduce the cost. We have volunteers we use, but you cannot do this in a government facilities that we just use their service, their facility like that. So that was one of the things that made me to feel that I have to join an NGO. So I joined Rotary International, and I became a member of Rotary Club of Katsina, where I also introduced service in hair and hearing care to reduce hearing loss in Katsina State. So while I was doing that, that was when 2009, that was when we lost my dad. And when we lost my dad, 2009 and 2014, 15, we started discussing of establishing a foundation for education for him, the children. So while we were discussing that, I was already doing a lot of work on hair and hearing care, educational fair hair and hearing care services for the less privileged and the low income groups, and also supporting the government of Katsina to improve training. So, and I was doing that by doing them myself. So when the opportunity to form Suleiman Hearing Educational Foundation came, I discussed with the other board members and my brothers and the people forming that I would love to add hearing to it. So they agreed, and we put hearing into the foundation, and we now have educational and hearing and educational foundation. So I provide support for the hearing aspect of the foundation, and we've been doing greatly since then.
Okay. So so it's that philanthropic spirit has just kind of, it's been pervasive throughout your journey.
Yeah, it has. It has been. It has been. Okay, are you the one playing now?
It's your turn. I know it may be hard to
You're
monetize
already
once you get
checking
to
me.
the.
You are checking me here.
No, that's the queen. It's not checked yet.
Okay, this is the king. This is my
That's
queen.
the
You're
queen.
you're already checking my king now.
No, the king is on the white square, so it's not checked yet. The queen is
Okay, the
checked.
king. Okay, no, okay, the king. This is the okay. This is the king. Yeah. So I can use my king to take this one now. I was mixing. I think that the king is the one that but now you are. Yeah. I cannot even take. Yeah. But why is he not taking it? My. I'm
The king can
confused
only
now.
move one square at a time.
Yeah. So I'm still thinking this is the queen anyway. So this is the king. This is the queen. I'm moving now. Is it?
Yeah.
Okay, that's the queen. Queen. Okay.
Okay. So what else does it do? I remember when we went to Offa, we went to the orphanage. Is that part of Chef where we did
Yeah,
the?
it's just to help people. Yeah, the orphanage is just to help people with that are less privileged. Those ones were not in terms of health, but we just to improve the nutrition. If you look at sometimes the kids, because of nutritional deficiency, they can also have anemia. They can also have hearing loss. So it has is a circle. Poverty of circle also increase incidence of hair disease and hearing loss among people. Also, it's also affect their education. They will not be able to study well if they don't have good food. So that one is also support. Like during the Ramadan, we used to give hearing check, health check, and we also give food for people free of charge, free food during Ramadan. So it's one of the humanitarian work that Suleiman Hearing Educational Foundation is to do to support the community.
Okay. So what is the Rotary Club? What is the?
Yeah, Rotary Club is also is a global humanitarian club that was developed, started in the United States and now expanded across the entire world. It has different districts, different club in different communities, and people are supposed to focus. When you form it into the community, you help the community where you are, your club exists. Like in Katsina State where I live, there is a club called Katsina Rotary Club of Katsina Metropole. So we have some numbers. Also have diverse membership. People that different tribes, different religion have formed it, and their way is to also be able to help to improve lives in the community. And they support healthcare, they support education, they support entrepreneurship, but they are professionals that comes together to be able to give this. For you to be a member of Rotary, you need to have a job to be able to help people in the community, and it also helps in networking among people that does good in the community. So for me, when I joined them, I was using members of the Rotary Club as volunteers to be able to help me in my hair and hearing care journey. And I also support some other projects from Rotary, like family health and also reducing polio vaccination and many things like that. And also attended a lot of Rotarian activities across the country. So as a humanitarian, you are exposed to be able to join all those type of organizations.
So polio still affects that region. I thought that
In
polio was
Katsina, that was when it was still, yeah, they were still, I don't know now, I don't know the data now, but at that time there was still one or two polio, they still exist, but now I'm not sure. I think it has, I don't know, there was a time Nigeria was polio free, but I don't know, I can't tell you what it is now,
okay. Okay.
whether we're still polio free or we are.
Okay. So, um, could you? What were the biggest structural obstacles? Cost, equipment, training teams, cultural barriers. Obviously, we're from the western Nigeria, Yoruba, but you're in the north. But yeah, just in that region, what were the biggest obstacles around the disability, and where did the hardest resistance come from?
Yeah, the biggest obstacle is in terms of attention to by policymakers to the issue of hear and hearing care, because hear and hearing care is not yet included in the primary health care programs. where every child born will be screened, or every child going to school will be able to screen for hearing to be sure that hearing is okay for them to have a good school, communicate well in school. So there's no attention because there's competing resources to take care of poverty, food, nutrition, water, electricity, other type of healthcare like cholera, a lot of things that they're doing. So they'll be looking at hear and hearing as not a priority to them, but they will not look at can they give it funding? They will say that the funding is not enough. We have some other things that are killing people. Hearing loss is not actually killing, it's just making child not to be able to speak or hear, or making people to be deaf. But the thing is that it also worsens the economic status of the people, increases the level of poverty as long as people don't have education. So these are some of the obstacles and the awareness to the public, because the people, in terms of contextual aspect, a lot of people still don't want to use hearing aids to be able to increase their hearing loss, or they don't want the device, something hanging at the back of their ear to people to feel that they are deaf and they are using that thing to hear, like a stigma. And apart from the awareness that is not also good, is not also there, is also an obstacle to ensuring everybody have access to hearing care. Then if you look at the other particular type of obstacle, is based on the personality. People are the people that are really trained to be able to provide this care. In terms of the ENT surgeons, how many of them even have training in hear and hearing to be able to address this issue? Nurses and also community health workers that work in the community, how many of them can identify and treat this thing early, or maintain or refer these problems to tertiary care on time? So it's a big issue that the gaps, we have to identify the gaps and know how to advocate to the policy makers to work on it in terms of providing resources to solve this problem.
Okay. So it's like a kind of a feedback loop because of the lack of education. Well, obviously, governmentally, it's not, the issue isn't really highlighted, but with the people, the lack of education means that they don't even value kind of, let's say, pursuing treatment and like.
Exactly. They don't even know that there is existing treatment for it. They feel that if the child is not hearing, the child should be pushed to the school for the deaf. But they don't know that the child can easily be given hearing through some, the hearing can be restored. And because they don't, when you don't have information, you will not know what to do. Then also the government also are not ready to include it. The way they will work on meningitis, the way we work on measles, the way they will raise awareness or the importance of eye care, they are not doing the same thing for hearing care. So when the government are not being part of it, then the people too will not know how important it is.
Okay, it's your turn, by the way. But
It's my turn now. Okay, let me go. Let me see.
tell us about a case that stays with you, a patient, maybe without names or whatever, whose story captures why this work matters.
Yeah, if I tell you about the first cochlear implantation that was done in Katina, about two kids in 2011, there was a child that was 6 years old that lost his hearing from meningitis, and his name is Mohammed Kufabai, and he was one of the people that I chose for a free cochlear implantation in Katsina State. The government of Katsina State was the one that sponsored it, and we had experts from India, from Austria, and we have surgeons from all over Nigeria that were there to be able to support the child that had a free implantation. So through him, we were able to develop a rehabilitation care. We were able to train the first auditory barber therapists in northwest Nigeria to be able to take care of him. Then our team was able to also train an audiologist for the technical support, and we were able to get the family to accept these children from having a cochlear implant, and also accept to travel with these children to India for the first time for them to have their first 6 months rehabilitation care before coming back to Nigeria. So it was a big one. But the good thing about that child is that the child regained hearing. The boy's speech came back, and he was able to resume back to school, his primary school. Today, the guy is in university. He's in the third year doing computer science. So the guy is living his life, and he also an entrepreneur. He makes caps. And let me see what I have his picture here and see if I can
He
share the
must be
screen.
like 21 now. Yeah, he must be like.
Yeah, the boy is doing very well. He's in the college now. He's doing great.
Okay.
So the boy is, some of them are inside our websites, and you'll be able to see some of these stories there. So the boy is one of the stories that inspires me and makes me to be able to say to. But I have other stories of some of these children that went through treatments, and they are doing very well now.
Okay. So you want to share the screen or something, or?
Yeah, I was saying that when I can, some of this thing about, I will see, like, I've seen how I have his picture in this.
Okay. I can edit it in after as well. I can do that after.
Okay, so yeah, when I talk about them, I give you the picture of some of these surgeries. Then the other thing that also, the story I also want to talk about is creating the service, because after we had a cochlear implantation, making the community to understand and also know about hear and hearing care, and engaging the community to. This is the boy. Okay, let me share my screen for you to see. Are you sharing the screen?
I've stopped sharing my screen now, but yeah, you can.
Okay, should I share my screen?
Yeah, go ahead.
Where is the video? Let me see. Share my screen. Let me see what is sharing. It's not sharing what I want to. What is he sharing?
So you share screen, and then you click on specific window. There's different tabs.
All these windows are just sharing. No picture there.
Go to share screen. So click on the purple.
Okay, I'm coming. Let me go. Okay, let me go to share screen. Okay, let me look for the one I want to share here.
Yeah, so it would be where it says window. Go to the window.
No, for my window, it's not showing any. This one is like.
Or the tab or the Microsoft Edge.
Okay, let me see. Let me see what.
Worst case scenario, I'll just edit it in after. Just edit it.
Let me see. Like this one now, I want to share this one. It's not just showing. Let me see what I can.
So where it says share screen, you click on the tab at the.
No, it says share screen, but there's no tab that came here. The share that select tab here is not the. I'm sharing intervention. These are some of the slides I have. I've not seen the pictures.
Oh, is it PowerPoint? Oh, okay. So it's a PowerPoint.
No, it's like the screen. No, not the PowerPoint. I'm supposed to
website?
see the. No, it's on my pictures, on my documents.
Oh, okay. Yeah, that may be a bit more difficult to do because.
But I've even opened. Okay, wait. Let me see what I. Not okay. It's going to screen all this. Okay, I can understand now. Okay.
Click on window, not entire screen, and then window the option will come up.
I'm coming. Yeah, if I click on window,
Yeah, and then click on whatever.
no, when I
Software.
click on window now, I'm not seeing any documents here now.
Is it open? Worst case, I will edit it onto
Yeah,
the.
I'll just send these pictures to you so that you can edit. I'll talk about them, then you pick the pictures there. Like that guy, I'll talk about other things that also interest me, that inspire me about the training I had and how I'm able to train some other young surgeons on, because those are non-existing service in Nigeria. So I was able to build young surgeons and also be able to move to from Katsina. I was able to develop here in hearing care in Kano State, and also to help support the first cochlear implantation done in Katsina State after like 8 years of doing it in establishing it in Katsina. I was able to do it in Kaduna State. The first implantation in Kaduna State, we were able to do the first set of children that had implantation there. So I think those are some of the things that have given me a lot of joy because of trying to expand here in hearing care in the Northwest Nigeria. And also we're able to train a number of people at the primary care, hair and hearing care level, and develop audiological care and speech therapy care also within the Northwest Nigeria, which is also good.
Okay. If you could change one thing about the healthcare infrastructure in Nigeria tomorrow to accomplish this work, to accelerate it, what would it be?
Yeah, well, I want to include here and hearing care into the primary healthcare scheme, where every child will have access to screening before school, and when a child is born, they will be able to have hearing screening done for it to be able to detect hearing loss early and be able to get intervention early, so that every child can be able to live like any other child, not with a disability of hearing loss. These are some of the things I would love to change if I have the opportunity to do.
It's your turn, by the way. If you're
Yeah, I think I'm. I combining chairs and talking is a bit.
yeah, I can imagine.
It's a bit active for me. I don't know. Let me see.
Do you want to leave the game alone, or what do you want to?
Yeah, if I want to play chess, I know I want to play. But now it's difficult for me to play and just to be talking.
Okay.
So,
Okay. There's a.
are you almost rounding up?
We can start rounding
You
up
can stop
soon.
and continue another time. Yeah, maybe.
Okay. Or worst case, there. Let me just move on, and then we'll round up here, and then we'll. Okay.
Yeah, we
So
can find a time,
looking.
talk again, and put more. I can now set up some pictures and see when you want to talk about some of the work I've done in Nigeria. Yeah.
Okay. So, um, looking back at the decisions that got you here,
Mm-hmm.
what was the one you almost didn't make?
That got me to where I am today. Uh, I cannot say which one was I because of the passion I had for hair and hearing care. I always want to do what I wanted to do in terms of training, in terms of buying all the equipments I needed, in terms of getting all the rehab, which took me time, and I had support of my family, my wife to be able to do that. It was tough because I was really trying to do a very difficult task in developing hearing care in Africa. So it's a bit tough for me, but I didn't believe I couldn't do it because I was still able to do it because it's a passion, it's something I love to do. And I was still able to do most of the things I wanted to do. And though for me, what I feel that pains me that I was not able to do is to replicating myself. I remember when I left Nigeria, there was nobody, because at that time I used to do most of the surgeries. I do surgeries, I provide the care for people with hearing loss. As long as they have, if they don't have money, I can still also I can arrange them during some time and do it as a voluntary work. But when I left, everything became almost empty, both in Katina and Abdullah, the hospital where I was practicing Kano. Equipments were left there. People were not doing the surgery because they were not trained. And I was not able to produce somebody like could do the surgery before I traveled because the system was difficult. The training opportunity was not there. The infrastructure and cost of training was not there. So those are some of the things that I felt, and those are the things I'm trying to replicate, to produce back, to be able to reintroduce, see how I'll be able to train people that I'll be able to, whether I'm there or not, then people will be able to have access to surgical intervention or medical treatment.
Okay. Okay. So I guess I'll summarize it. I'll try and like tie everything back. So final question: if somebody was listening to right now, who's like standing at the beginning of a long path with this medicine, surgery, entrepreneurship, mission, what's the one thing you'd want them to hear?
Yeah, what them to hear is that when they're training, they should always include research. They also train because research will help them to improve on their work, and when they are learning the skill of being a surgeon, they will be also be so that they have to understand what is the data like. Am I seeing a lot of people with hearing loss? Am I seeing a lot of people with chronic separative otitis? What are the issues? How will I be able to solve it? What are the ways? They have to create a research questions for them to be able to answer them, and it will also improve their level of the impacts they are going to make. So I think those are some of the things I'm going to tell them, because also level collaboration with working with other health workers, working with their colleagues, and global collaboration also help to be able to push the work we're doing forward than working alone. The other thing I want surgeons to know that when you become a surgeon or a physician, your work doesn't limit in your clinic or in the theater. It goes beyond that, because you have to look at the contextual part of the patient coming to you. Some of them don't have money to eat. You don't have money to buy medication, but you just see them and look at the problem, and you write drugs, tests, and things for them to go. You never see them again. So you must be able to understand the problems, the culture, these things surrounding each person you see. And apart from that, you must also be able to understand that the policy people that are outside, they don't know what you are seeing there. You must be able to link up with the people in government to be able to let them see people making decisions for everyone to understand the needs, so that your work will be able to make more impact. And you not work for years, retire, and everything is still the same.
Okay. So yeah, I guess that was the last question. But any other words that you have just generally for the platform or anything?
Yeah, the platform, what I have is that Nigerians, when you train physicians, you should also try to see how you can keep them. You can give them, even if you cannot keep them movement, you provide the parts that they can easily come in and out. They can come in and out and be able to. There are a lot of physicians that are going to be like me, that they want to leave, but they're also good. But you have to create opportunities for them, create the environment where they will still be able to stay and take care of people within the country.
Okay, so like to prevent like brain drain then.
Brain drain, yeah. Brain drain has to be prevented, and by giving them opportunity to live comfortably, to be able to work. And those ones that have passion, you try to support them to be able to move. Not that you discourage them, you frustrate them. So, and those are important for healthcare development, improvements in Nigeria.
Okay. All right. Thank you very much for this interview.
Thank you, sir. Thank you for the time. And thank you for the chairs. Sorry, I'm not able to play a lot of chairs because I was talking. I was thinking of what I was saying, and I was saying time. You know, chairs is a brain, or is a. You have to be concentrating to be able to know to make your moves, and you. It looks like you are so good in chairs. You can be discussing and still be talking. We are going to play when we're not in interview one of these days and see.
My regards to the family.
All right. Take care. Take care. Thank you. Appreciate it. Yeah. Bye.